Okay, we're going to go ahead and get started. It's 6 o'clock, and because we have people on Zoom waiting, we want to start on time here. So just want to say good evening to everyone and welcome. I'm really happy and excited that you're here today. My name is Carrie Foote. I am an associate professor of sociology with the IUPUI School of Liberal Arts. I am excited to be here today with my students from my HIV and Society class who have organized this event as part of our class civic engagement activities. Also, I want to acknowledge that today is Veterans Day. So I want to thank all the veterans for your service and to acknowledge that veterans have higher rates of mental health and substance use disorder than the general population, and many of them are living with HIV. We see you, we value you, and we thank you. Thank you all for joining us this evening for a lecture with Dr. Will Cooke, followed by a panel of people with lived experience. Just a couple of housekeeping for the evening. During this program, everyone on Zoom will remain muted. The chat box will be monitored for any questions that arise, so please feel free to enter questions and comments at any time. This event is being recorded and the video will be shared publicly at a later time. So I also want to thank our sponsors for this event, our vendors, the students in my HIV class, and our amazing ASL interpreters over here on my right. This event was made possible by your generous support. Thank you. So here are some short bios of our inspirational speakers tonight. In our time together tonight, we will learn about the syndemics of opioid use disorder, poverty, and the HIV epidemics among people who inject drugs in rural America. In his book, Dr. Cooke eloquently blends historical research, first-person stories of tragedy and triumph, his journey as a healer, and frontline experiences as a clinician who bore witness and responded compassionately to the largest HIV outbreak among people who inject drugs in recent US history. Against overwhelming odds and entrenched in immense socioeconomic barriers and the stigma of drug use in his small town of Austin, Indiana, Dr. Cooke shows how perseverance, love, and compassion are key to effectively addressing substance use disorder and HIV epidemics in his and similar communities. His book and the testimonies you will hear today will challenge us to see the humanness in everyone and encourage us to care for and work to end the suffering caused by the opioid crisis. Afterwards, we will also have the opportunity for the audience to ask questions of our speakers tonight and to answer those, and then we will wrap up the evening with a continuation of our health fair and a book signing event. So for now, I want to transition and let's watch a short trailer of the book. And without any further ado, I would like to welcome Dr. William Cooke to the stage.
Thank you for that kind introduction. And I just want to acknowledge Dr. Carrie Foote as one of my personal heroes, and I don't say that lightly. Indiana's fortunate to have you, and thank you for all that you do for everyone. I really mean that. Thank you for, yeah, please. Thank you for being here tonight. You honor me by your presence, and those of you watching at home on Zoom, thank you as well. And I want to get right to it. So the book's called Canary in the Coal Mine. I named it that because coal miners would go into mines, and they would need to know when there's toxic conditions there. And so they would bring canaries with them, and the canaries would warn them of toxic conditions. And what happened in Scott County really should be the canary to the nation, that there are toxic conditions that exist that increase people's risk of dying far younger than they should. So in case you don't know, Scott County is located in southern Indiana, right off of I-65 between Louisville, Kentucky and Indianapolis. Austin is in the northern part of Scott County. It's a town of about 4,300 people, and it was the epicenter of the worst drug-fueled HIV outbreak in US history. The incidence of HIV in that town rivaled any country in sub-Saharan Africa in 2015, just 6 years ago. In the book, I bring the reader into Scott County through my lens. I introduce the reader to Scott County by introducing them through a very naive young doctor trying to do good there, and my story and what happens to me during the first part of the book. And so just some background on me. I grew up in southern Indiana. My family was very poor. My great-great-grandparents were actually squatters on the Ohio River. They migrated out of Appalachia along the Hillbilly Highway. And my mom shares stories of growing up that are really terrifying to me. Sometimes as a kid, she would have to grab her belongings and scurry under the cover of darkness to find new shelter because her family got found out that they were squatting in the house where they were. Now she got married very early, at 16. She actually dropped out of high school. When she dropped out of high school at 16, it was the furthest anyone in her family had ever gone. And they moved to a military base, and that structure and people investing in them helped her escape the toxic stress that she grew up under. But not everyone in our family escaped that. In fact, her sister dropped out at 14, never really found that same structure, anyone to really care for her, fell into the cycle of addiction, and eventually she died at 39 of a drug overdose. That's my mom at my Aunt Sally's grave. When I went into school, having parents that grew up in poverty, and my mom having dropped out in high school, I didn't have the same resources that a lot of my peers did. Didn't understand what it was to take notes, how to study, how to prepare for exams. And so I wasn't doing the best. I wasn't doing terrible, but I was getting like B's and C's. My teachers kept telling me that I needed to try harder, just try harder. And I didn't know what that meant. I thought I was trying really hard. I showed up to class, I listened, I paid attention, I tried to do my best on exams, but I was getting B's and C's, and they said, you have a lot of potential, you just need to try harder. And then I got into college, and I met kids from a higher socioeconomic status than me. I joined some study groups. They were getting A's, I was getting B's and C's. I wanted to find out, what this was about. My college professors, try harder, try harder. So I joined these study groups, and I started to learn how to take notes, how to prepare for exams, how to study. And I went from B's and C's to A's. That effort that I was putting into school finally started to matter because I had the tools and the resources and the understanding on how to do those things. I wanted to talk about what's going on right now in America. We've seen in the news and in all what's going on with COVID-19 and how health disparities impact communities and an entire nation. This study was just recently published. It shows that our life expectancy in the United States is actually falling. We are living shorter lives now than we used to just a few years ago. And that should be unacceptable to all of us and should be an indication that there is some sort of toxic conditions at play. This was before COVID-19. Our life expectancy was falling before COVID-19. Compared to our peer nations, it's getting worse. The blue line's the peer nations, and the red line is us falling off from our peer nations. We shouldn't be living shorter lives in America than people in countries that look similar to us economically. We should live at least as long, if not longer. We wouldn't accept that for economy or the military. God forbid we went to the Olympics and came in last. What would we do? We would move mountains, right, to get that gold medal back. But we're last in life expectancy among our peer nations. And when you look at how much money we're throwing at this, it's even more startling. Our peer nations, they're living longer and longer lives. We've fallen off, and if you look at how much we invest in healthcare, we're deviating far from that. And so what I figured out, well, this is the pandemic effect. So so now this is getting even worse. Okay, the conditions that they have found that's causing this are drug poisoning, suicides, and cardiometabolic diseases. So it really is affecting poor white people the most, but every demographic group is affected. And that's what I found when I set up my practice in Scott County, is that something was taking people's lives younger than it should have. I was really impressed in medical school that we have invested a lot in how to take care of diseases. And I realized that there's no place on earth better at keeping sick people alive than the United States. We're really good at keeping sick people alive. But when I moved here, I realized that we weren't very good at keeping people from getting sick in the first place. There's a difference there. Keeping sick people alive or keeping people from getting sick. We've invested in keeping sick people alive, but we've really not invested. We're missing something because we're allowing people to get sick, and that's what's causing our life expectancy to fall off. In Scott County, I found a few overlapping things. An opioid epidemic, a demographic group that was at risk, poor public policy, and then infections set in within the community. Indiana ranks near the bottom of the country for access to addiction services. You can see that here. And then if you compare Scott County to the other places in Indiana, it's even worse. So Austin had no access to addiction services. So when I met people, there it was hard to connect them to resources. People were living off the grid. They didn't want to be found out that they were using drugs. It's not something that's easy to go up to somebody and say, hey, I'm using drugs, I need help. There really wasn't any access to that. Even going to a doctor, oftentimes if you tell somebody I'm using drugs, they kick you out of their practice, or they tell you to get out of their emergency department. There's a lot of stigma and shame built on that. So why would somebody be brave enough to admit that they're using drugs and they need help? So these are people living off the grid, unavailable to the healthcare system. Here I am, this young, eager doctor wanting to help people, and people would come into my clinic for help, but how about the people outside of my clinic that were not brave enough to come to the clinic? How was I supposed to reach people in those circumstances? I met a young woman named Samantha. She was in her late 20s. She came to me with low back pain. She'd been getting opioids from a different doctor out of town and wanted a doctor closer to her to be able to help her. And I told her if she's willing to work with me, work with physical therapy, try to reduce her dependency on opioids, I'd be happy to work with her. And she was, so she signed a contract saying that she wouldn't share her medicines, and she wouldn't use any other substances. And we started working together, and she did really well for months, and I was really optimistic for Samantha until one day a urine drug screen showed other substances in her urine. Now, I was taught in medical school that people who abuse their medications were really too time-consuming and not really worth keeping in your practice, and it's just best practice to discharge them from the clinic. We still see that today, where people get discharged from their clinic with no follow-up, no weaning, no anything, no referrals. And that's what I did. I wrote this form letter. I sent it to Samantha in the mail, didn't think anything of it, and went on with my day. A few days later, Samantha came into the waiting room, very upset. demanded to speak with me, told my receptionist that Dr. Cooke had cut me off, ripped up my letter in her face, threw it at her, started tearing off posters in my waiting room, knocking furniture over, screaming, hollering. Nothing like the Samantha that I knew and had liked and was working with. This was someone else completely. We called the police, had her taken out of the office, and I remember looking out the window at Samantha in the back of the police car, head down, hair down in her face, and I realized that my best memories of my Aunt Sally was when she was in her 20s. And here's this young lady abusing pain pills, just like my Aunt Sally, and my Aunt Sally died at 39. That's just like 10 years later for Samantha. So I asked the officer, what kind of help is there for Samantha? I was really worried about her. And he just kind of shrugged and walked away. He was as frustrated and disheartened as I was that there's no help for people like Samantha in Austin, in most of Scott County. So I started realizing that there's two trajectories that people can take in life, and it really boils down to what foundations there are. And if their basic human and safety needs are being met, then they can move on to feeling like they have a sense of belonging, that people actually care about them. And if people care about them, then they can care about themselves and maybe try to do something better in life and seek higher education and helping other people even. And the opposite's true too. If life starts off with a shaky foundation, generational poverty, toxic stress, adverse childhood experiences, it disrupts the neural development, leading to poor decision-making and social problems and risk-taking, and then you're using drugs and other poor life choices, and it leads to early disease and early death. So these two things all start from the foundation, and it's really wrapped up in the social structure. And here I'm this doctor, and I'm really good at taking care of diseases, but what about the social issues that I'm seeing all around me? I had no idea how to take care of that. But I did know that something toxic was happening, because I was screening women for cervical cancer that had never been screened in their lives or hadn't been screened for years, and I was detecting cervical cancer in women at late stages and watching some of them die. And cervical cancer is a preventable disease. No one should ever die of cervical cancer if they have access to screening. And they didn't. And so you can see here that cervical cancer deaths have trailed off, but they're plateaued. We can't get down to zero for some reason. There's something holding us back, something toxic that's existing in the communities around America that's keeping us from getting to zero, getting to prevent people from getting sick in the first place. And if you think about it, if you're allowing people to die younger than they should, that's a form of violence. And it's not physical, direct, visible violence where somebody walks up and whacks somebody, but it's invisible. It's built into our culture where we justify it, and the structures with the way that our insurance reimburses things and our access, and the way healthcare is even defined. And just like me in school, I was trying really hard. My teachers didn't see that. They thought I needed to try harder because they didn't see the gradient of generational poverty and early dropping out of school and things like that that I was pushing my education up against. My patients were doing the same thing. I may have looked at them and thought they weren't trying very hard because their diabetes isn't controlled and they're using drugs and all of these things, but I don't see that stuff that's underneath of that, the poverty, the unemployment, the lack of access to transportation that they're trying to push their health risk up against. And eventually they get so tired, sometimes they give up. And so what I realize is that there's overlapping things that need to exist in order for somebody's agency to matter. Their life choices only really matter if we've helped provide their basic human and safety needs. If they have access to resources to overcome the social circumstances that they may be battling against, if those social circumstances seem so overwhelming that they can never overcome them, they're going to give up. And then they need access to healthy choices, because people can only choose from choices that they have access to. If we don't provide that access, they can't make those choices in the first place. And so we can't hold them responsible unless these three things are overlapping, and then all of a sudden they have access to health, prosperity, and wellness. I remember working in the emergency department, and this this young woman brought her sister in, emaciated, groaning, barely conscious, looked on death's door. She had track marks. We put her in the stretcher, hooked her up to the monitors. Her blood pressure was low. Her pulse was thready. I knew she needed fluids. I thought she was probably septic. We needed to do something immediately. I told them to push 2 liters of fluid immediately. And they said, we can't get IV access, Dr. Cooke. She's used up all of her veins. And there's only a few ways to get people IV fluids if they've used up their veins. And one of those is putting an IO in, an interosseous infusion. It goes directly into the bone. Bone's very painful. We use a drill, much like you would use at home around the house. And I asked for the IO device. I pushed it through the skin, pulled the trigger into the bone. The needle went, she screamed in pain. Her sister, I forgot, was actually in the room, gasped and started looking around at us. And we basically ignored her because we were trying to take care of her sister. We hooked up the fluids, started pushing the fluids in. She's moaning, groaning. I come around the bed, start looking at, or feeling around under her clavicle to put in a central line. It's putting a large needle about the size of a cooking thermometer into a large vein that runs underneath of the clavicle. And I'm about to do that, and the sister just cries out, "Why are you hurting my sister?" And I'm thinking, hurt? I'm trying to save her life. And I turn around with this huge needle in my hand, and I'm like, "What do you mean?" And she said, you're hurting her. You're not treating her like a person. That's my sister. And it was like a cold bucket of water hit me in the face. And I realized, she's right. I'm not talking to her. I'm just doing things to her. I'm not telling her what I'm doing because I'm trying to save her life, but that's no excuse to not treat her like a person. And my mind went back to when my mom got that phone call that her sister had an overdose, and she rushed to the hospital. And she was told her sister had died. And my mom, she knew that, in order to try to save her, they had stripped her naked so that they could have unimpeded access to her body. They had put a tube down her throat to help her breathe. They'd done chest compressions, if done right, were strong enough to break her ribs. It was a violent, undignified death. But they tried to save her, and we were trying to save her. But that doesn't mean this young woman was a drug addict or a mannequin that we were just doing procedures on. It was this woman's sister, somebody that was cherished and loved and cared for. And it changed my perspective, and I started talking to my patient, letting her know what I was doing, and I gave her some medicine to help calm her down a little bit and help her feel better. But that stuck with me. That's my Aunt Sally in the middle, and my mom, sitting next to her. So there's 7 vital conditions that have been shown in decades of study to define how well a community is going to do with health. If these things are missing, people don't do well in their community. And it's things like meaningful work, a livable wage, lifelong learning, so having access to education before elementary and after high school, being able to learn a trade and being able to be employable right after high school sometimes. Humane housing that's diverse and safe and close enough to get to grocery stores and schools and work, reliable transportation. And then that sense of belonging, because if you don't feel like you belong, why would you try? Why would the world be a safe place, Kids don't do well when they don't think anybody's got their back. And people that work in social services and such, they know this. They see those kids give up way too soon. But if they have one person they can turn to, oftentimes that's enough to give them the hope that they need to go forward. Because it's not an effort issue. This is a lawnmower cord that I keep in my office to remind me that effort isn't always the problem. Sometimes the engine's not working. And I pulled this thing so many times I broke the cord. But we need to look underneath the engine sometime and see what's wrong with the structure. A few years into my practice, I met Samantha again. She was about 10 years older. She was in her mid to late 30s. And she was in the emergency department this time. She came in with abdominal pain. She hadn't been able to go to the bathroom in several days. And I figured that it was the pain medicine that she was using. It can cause constipation. And we acknowledged each other awkwardly, and I promised her I would, work with her to try to help. And we started doing studies and stuff like that. And the man with her came out into the hallway and handed me this letter and said, "Samantha's been carrying this around in her pocket for a couple of years, and I think you should read it. It's addressed to you. So I read it, and it described this childhood filled with toxic stress and abuse. She never felt like she belonged. There was nobody that she thought had her back, and she grew up under that. When she was about 12, 13, she went to a dentist. The dentist gave her some pain pills. She took those, and suddenly, for the first time in her life, all the dread and fear that she had been living under went away and melted, and she felt okay for the first time in her life. And she started chasing that. She didn't know what pain pills were at 12, 13. She didn't know what it was, but she knew that it made her feel safe. It made her feel okay for the first time. And she continued to chase that, and that led into early adulthood and in and out of relationships with men that she thought could help her and ended up not. And she met me, and she thought, maybe this doctor can help me get past this and reclaim what I wanted for life. And you found out I was using other stuff and cut me off. I've not been doing well. Would you please help me? I don't want pain pills anymore. I just want help. And I folded up the letter, and it was sad, but at the same time hopeful, because I thought I had a second chance with Samantha. And I vowed right then and there would be nothing that prevented me from working with her and helping her achieve the goals that she wanted to do better in life. And about that time, I pulled up her CT scan, and it showed metastatic cervical cancer, a completely preventable cancer that no woman should ever die from if they have access to health care that I cut her off from. And that screen just condemned me. It's like, you did this to her. And I had to go in and tell her that she had metastatic cervical cancer and that her 2 young kids were going to grow up without their mom, just like my cousins did, very similarly. So that changed my perspective on who I was going to be willing to work with and who I was not going to be willing to work with. And from that point forward, I've never told a patient they can't come back to see me. I'm always available, whether they can pay or not. If they miss 17 appointments in a row, we're still there to help them. If they're late, we're going to work them in. I'm never going to allow something like that to happen again. It changed me. I don't know why that's there. That was several slides ago. So what happened in Scott County? In 2011, we saw an increase in overdoses, abscesses, endocarditis, spinal infections. We knew that there was injection drug use going on. The Indiana State Department of Health knew this and recommended that harm reduction strategies be implemented throughout the state. Nothing happened. And then in 2012, a Reuters piece was released nationally identifying Austin, Indiana, in Scott County as a hotbed for addiction of injection drug use and a place that needed help. Still, a national article. 3 years before the outbreak, nothing happened. We were identified as a place that had a lot of hepatitis C year after year. Hepatitis C is a harbinger of HIV. If a community has a lot of hepatitis C in the community, HIV is just around the corner. You need to start doing something to prevent the continued spread of infectious diseases in the community. Nothing happened. And then the HIV outbreak happened. And the blue line represents those contracting HIV. The red line is when we diagnosed them. And you can see there's a several year gap in between those two. Nothing was being done to look for people with HIV. That's the public policy piece. Nothing was being done to prevent the spread through, condom distribution or sterile syringes or linkage to care, because we know that treatment will prevent the spread of HIV. The cases continued to climb. Eventually, Governor Pence issued the emergency order. 5 days later, we opened the first HIV clinic right in the heart of Austin, so people had direct and easy access, because transportation is an issue, and feeling safe accessing care is an issue. So we wanted to make sure that people had that access. A few days after that, or I think a week after that, the syringe service program opened, and immediately the numbers leveled off. But so many people contracted HIV in Scott County that year that it represented a third of all the new cases in the entire state. 4,300 people, a third of all the new cases in the state. It increased the number of HIV cases over the previous year in Indiana by 20%. This was a significant outbreak. It didn't have to happen in the first place. This is the demographic breakdown. Young people split fairly equally between men and women. It was an early infection. Most people had co-infected with hepatitis C. So again, these are people living off of the grid. They didn't want to be found out. There was shame and stigma. So our biggest challenge was just to find people. We couldn't sit in the clinic and just wait for people to come to us. There's the mantra in medicine, do no harm. Well, that's very passive, isn't it? Don't harm people. I think most of us can do that. We can not harm somebody. We can't just sit back and wait for people to come to us. I think we need to move from do no harm to protect from harm. And protecting from harm is a much different animal. It means we get out of the clinic, we get out into the streets, we find people and protect them where they're living, where the harm is occurring in the first place. Part of the strategy was to develop what's called ROSC, Recovery-Oriented Systems of Care. And we brought in the entire community across sectors, the hospital, the schools, the jails, the social services, the medical services, faith-based organizations, and we all centered the patient in the middle and said, what does it take to help anybody access recovery at any time in our community? And we developed what that meant in our community. We have started to work together towards a common goal. But this became the canary in the coal mine for the nation because nothing was done when we could have done something. The toxic conditions were there and we didn't take the warning. A Lancet article in 2018 showed that if just screening and linkage to care had been put into place in 2011, 10 people versus 200 would have contracted HIV. We would have prevented the whole thing. I wouldn't be standing up here in front of you talking about this. Maybe you're talking about something else, I don't know. But it wouldn't be this because this wouldn't have happened in the first place. And we have that opportunity to change where we're going as a nation. We do this by combining biomedical interventions with behavioral interventions and structural interventions and putting the people in the middle. Structural are things like decreasing inequity and decreasing stigma and discrimination, better education, and enacting better laws. Biomedical is increasing access to medical care, MAT, harm reduction, screening like SBIRT that can be done in a dentist's office, like where Samantha got it. SBIRT stands for screening, brief intervention, and referral to treatment. It takes like 5 minutes. And if you can identify in that moment, you can briefly intervene and refer them to treatment. Dentists can do this, surgeons can do this, emergency departments can do this. Screening needs to be a part of it. And then protecting moms and babies. And then behavioral with education, therapy, employment, and then of course, peer support with people with lived experiences. When we did these things in Scott County, a beautiful thing happened. The number of people living with contracting HIV plummeted. You can see that with the red line, and the people entering into recovery increased. You can see that with that blue-gray line. And then the number of needles needing to be distributed started to taper off because fewer people were injecting or injecting less times a day. The thought was that these are people who are injecting drugs, living on the street, off the grid. Even if we found them and connected to them, they wouldn't be willing to take their medication. They were thought of being a lazy, criminal, degenerate. These are bad people that aren't going to take their medicine. Scott County ended up, and still does, have the highest percentage of people living with HIV who inject drugs. So those two things would tell most people, well, they're not going to take their medicine. We have the best viral suppression rate in the state. The best viral suppression rate in the state. Viral suppression is when they're taking their medicine every day and they get their viral load down to where it's not harming them anymore. And if it's undetectable, they aren't even able to spread it to other people. They're taking responsibility for their own health and the health of their community because it's being provided them in a way that feels safe and accessible. We're addressing those 7 vital community conditions by providing transportation. We're going to find them. We're allowing them to feel safe accessing care and encouraging them. And when you do that and your basic needs are met, resources are there, and choices are available, people are willing to make the right choice. Their effort is to do better. Most people will always try to do better if they have the access to that. And this proves that. They're blowing the state away. They are doing it, not me or not anybody else. People living with HIV who were injecting drugs are showing that they're willing to take responsibility for their health. I can't read that screen way back there. This is the syringe service program. And you can see before the syringe service program opened, Syringe sharing was at 74%. It dropped down to 22% after the syringe service program opened. Disposing of syringes safely, only 18% of the time. After it opened, 86%. But people living with HIV, it went up to 98%. Again, if people have access, they're willing to take responsibility. People living with HIV didn't want other people to contract HIV, and so they were disposing of their syringes more safely than even the general population there. Indiana, unfortunately, has the most hepatitis C cases in the country, but in every county that has a syringe service program, those numbers are at least staying the same or going down. In every county that does not have a syringe service program, the numbers continue to climb. In Scott County, the number of people living with hepatitis C have declined by over 76%, and those living with contracting HIV have declined by over 95%. In fact, last year, we only had one new case in the entire year last year, one new case versus 200 that first year. So we need to stop focusing on diseases, treating diseases, investing in diseases, because we don't want to be the place in the world where it's best to treat diseases and keep sick people alive. We need to get upstream, find out what's causing people to be sick and dying early in the first place, and start investing there and trying to keep people from getting sick in the first place. Because again, our life expectancy is falling, especially against our peer nations, and we don't want to be the place in the world where it's worse to be born. You know, the United States should be the best place to be born in the world. But right now, if you're born in America, you're going to die younger than somebody born in one of our peer nations. That's unacceptable. So what can we do? We can't just focus on diseases. We need to get to the roots of disease that can be traced along the tragic history of marginalized and discriminated against people. Let me skip over here. Here's a few resources that I would encourage people to look into to learn more about what we can do. And based on some of that, I developed some of these public policy conclusions that economic policies need to address the economic and social strains that made communities vulnerable in the first place, to increase that increases mortality, especially deaths of despair and chronic suffering. Basic human and basic safety needs need to be prioritized to the level of human rights. And then funding shifts from downstream diseases to the upstream person-centered oriented focus. Structural injustice must be countered by identifying and ending policies and practices that reinforce bias and racism. Public health infrastructure needs to be funded to maintain skill, surveillance, and the ability to identify needs and quickly respond. We didn't have that in Scott County. If we had just been screening and linking people to care, it would have prevented the entire HIV outbreak. And our communities are made up of people with diverse experiences and beliefs, and that's good. That's a good thing. Solutions should be focused on inclusion and diversity, and we need to invite people with lived experience to be a part of the solution. Because we can read books, we can go to school, but we won't know what it's like to be born in a community, raised in a community, face the obstacles and barriers that people face in that community unless we connect with people from that community and hear them first and learn from them. And one of the things I tried to do in my book was to take that focus from me and shift it to people with lived experiences, the community, and allow me to just fade into the background of the story. And so by the end of the book, I'm talking more about the community solutions and people with lived experiences and what they're doing and what we can learn from them. And just like I tried to do in the book, I want to do that tonight. And I want to invite people with lived experience to come up. I'm going to step off the stage and shift the spotlight to them and allow us to learn from their experiences and what it's like to be in a situation like what happened in Austin, in Scott County. And hopefully we can all learn a little bit from them. So Jerrica, Cole, Billy, Dana, why don't y'all come on up, and I'll turn this over to Dr. Foote. Thank you for listening.
So I want to thank you so much, Dr. Cooke, for all your amazing work in the community and just for caring. You know, often we don't find physicians who really have that capacity for caring, and you clearly do. So thank you for that. So we're going to shift here now to hear from our panelists about their lived experiences related to the HIV outbreak in Scott County. So with that, I guess we'll start with, let me move this along. I think we're at a few slides, a bunch of thank yous that Dr. Cooke had. So I think, Jerrica, we're going to start with you if you're ready.
Yeah.
So I'm going to just let you go ahead and take over.
Okay, so my name is Jerrica Hall. A lot of people know me in my hometown by Jerrica Cooksey. I just recently got married a year ago. I grew up in Scott County. I had friends both in Austin and in Scottsburg. And as a kid, I always found that I was a follower, right? I had a lot of issues at home. Both of my parents had experienced in drugs, but mainly what problem I had as a child is the abandonment issues from my real father, right? There was a lot of things that was going on whenever I was a kid, and I was very confused as a kid. And then I noticed as I started to get older, really all I wanted to do was be heard, right, and loved and cared about. But I became like I said, a follower. I started experimenting with drugs at the age of 12 and 13. And I remember looking back at my 12th birthday party. This is kind of when I realized that, I wasn't like other kids and that I had some issues. And I remember on that birthday party, what I was concerned about when I was turning 12 was sneaking into the refrigerator and getting my mom's wine, right? And drinking it at my 12-year-old birthday party. And these other kids that were sitting around me, they were scared. They didn't understand. They were like, what are we doing? Are we really going to try this? And me, I'm like, yes, that's what we're doing at my birthday party. So I snuck this wine. I went upstairs. We drank it. And a few kids went home and, told their parents. And it put me in a real bad situation. A lot of the parents, as I got older, looked at me as the bad influencer, right? So in high school, I started, I did a few things. I was a cheerleader. I was doing really great my freshman year. Like I said, I was still experimenting with drugs, but I was actually focused at one point. And then I ended up getting into a relationship. And this relationship that I got into whenever I turned 16, for so long, I wanted that male compassion, and I didn't realize, that the relationship that I was getting into was abusive from the start, right? Certain things that normal people would see, I didn't see. And we started experimenting with drugs, and I went to sorry, I'm nervous, but my junior year of high school, I completed. Going into my senior year, I went to school for maybe about 3 days. And I walked into the principal's office, the assistant principal's office, and I said, I'm dropping out. He tried to talk me out of it. My mom tried to talk me out of it. My parents were like, please don't do this to yourself. And I was ready to go. For some reason, I had always just wanted something in my life. I was earning for something, and I was broken, and I was hurt, and I just felt like this man was all I needed, right? So I jumped into this relationship. I ended up moving out of my house that same week that I dropped out of high school. And I went to live with this man, and we stayed together off and on for 6 years. We moved to Austin in 2013. And when we had got an apartment in Austin, I started working at a gas station, which is Huck's gas station at the main stoplight in Austin. And I started to hang around the bad crowd. Anyone that was using, people would come up and be like, hey, Jerrica, have you tried this? And I'd be like, no. So Oxycontin was introduced to me one night while I was working at Huck's gas station. One of the friends that I knew pulled in, and he was like, hey, Jerrica, I know you've had a bad day, because I had a really bad day. And he was like, try this, it'll make you feel better. And I remember trying it. And he, once I got that Aphora, it was just downhill from there. So I got diagnosed with HIV in 2015. My diagnosis, sorry, that 1 minute got me. But that the diagnosis was given to me June 6, 2015. And today, I just want to let you guys know, I'm a person in long-term recovery. I no longer have the fear of dying. I have a beautiful daughter that was born with me having HIV. She did not contract HIV. I'm married to a man that does not have HIV today. He's HIV negative. I'm very big in the community, in my recovery community. And I also am working with Dr. Cooke's Foundation's Family Medicine and Peer Support. And if I had more time to talk, I would, but thank you guys for listening. I really appreciate it.
And we're going to have plenty of time to ask Q&A. So you're going to get questions, Jerrica. So we're going to move on here to Billy and Dana Snowden, who's going to share a little bit about their experience.
Hello, I'm Dana Snowden. Billy and I grew up in Austin. All of our lives went to school at Austin, but we did not experience a lot of the things that came along with poverty and things like that. And so we moved into a not so great neighborhood, not really realizing, and it kept getting worse. And we were kind of scared at first. And then we thought, maybe we should just embrace this and get to know the people around us. And we did, and they were great. And we realized that we had a lot of prejudices we didn't realize that we had. And we realized that everyone in our community deserved respect and love. And when we saw that, we decided to do a mission and outreach for the community children. We have 4 daughters ourselves, but we decided to do this for the children. And slowly it started to attract adults as well. So we started out as Kids Club, but when you have adults, you don't really want to call it Kids Club. So we decided we needed a new name, so we came up with Hope to Others, and that's H2O for short, because we feel like that people need hope as much as they need water. So we grew into a church from that kids club, and we just sought to offer hope without judgment to everyone in our community. And we tried to start addiction support groups because we knew our community needed it, but they never went anywhere until the epidemic hit. At the beginning of the epidemic, Billy had just finished his master's in social work. Actually, I think we came to this exact place for him to get his some sort of award that he had gotten. So this brings back memories. And so I learned a lot too, because I have an English degree, and so I would edit his papers. And so everything he learned, I learned. So I'll
give you her email address.
So this really helped prepare us for more in-depth community work. And we just began renting a bigger church building. We've been in like a little house in the prairie church. That's where we had been before. And then we found this new building and we started renting it, which had all this space, all these rooms and a gymnasium, which was wonderful. We didn't really know why we were going to need it. And then the epidemic hit, and it was very obvious why we were going to need it. So as soon as the epidemic hit the news, we had a couple in our church that they had been with us. They've been with us for a while, but were actually active in church, and they had given up their drug use, but they had been very active drug users. So they knew people who had HIV that they had done drugs with. So they knew they needed to be tested. Well, it was the first few days, so there was no way to get tested in Scott County. So they had no transportation, they had no vehicle. So I took them to a neighboring city, Seymour, and we went to the Walgreens. And it was such a strange situation. There were a lot of people there getting tested because people were hearing about HIV and going to be tested somewhere. And it was difficult because they were waiting in lines, and people would come out after they were told the news, and you could tell by the look on their face whether they had been told that they had it or not. It was horrible. It should not have been. That's not how it should be. But it was really hard. And so they got their news. One of them had it, one did not. And it was horrible. I mean, what do you do? I mean, I was just like, I'm so sorry. I took them out to eat to try to make things. I didn't know what to do. And then I just said, we'll try to help you guys any way we can. And then of course help did come after that. And And now I'm going to let Billy talk a little bit.
I think dealing with stigma in the community was one of our biggest issues. Even though we learned about Ryan White and back in the 80s, still people in our community were afraid of catching things off the toilet. I remember us having lots of conversations with kids and adults of how you can get HIV, and so I think there's a lot of learning moments during that time. Also the stigma around syringe exchange. When we heard and looked at data, I mean, the data shows lots of things, harm reduction. And so one of the things that we did as a community, part of our church, was to embrace the recovery community. We had space. And so we told all the recovery groups, hey, we have a space, we'll give you a key. No charge, just come and use our facility. And so in a recovery engagement center, various things going on at a church where we weren't really a part of it per se, because I have a full-time job and Dana homeschools. So, but we had a lot of people in our recovery community that came and was part of that. Getting to know Cole, especially during that time, was amazing, and seeing his growth. And but we also had things like a shower, just various things in there, that just food, just loving people where they're at, and teaching other churches doing that too, because there were other churches that were involved, not just our church. There's lots of other churches in our community that have helped us out, helped fund us paying rent for the building, but and then also just other volunteers. And so as we were there, we were able to I don't know, I'm having trouble now because I'm thinking I'm waiting for the time to come up, right? More open to lots of support groups. There were other churches that stepped up and started hosting support groups, and so that's what we kind of did. Where am I at? Oh yes, and then also just the needle exchange program. We were one of the churches that just said, "Hey, come to our." We needed a box, for the needles to be dropped into, and a safe place for them to do that. And even though that kind of looked negative in our community with a lot of the churches, our two main drop boxes are at churches now in our community, which is awesome. And during that time, over the years, we continued, and you see the recovery wall up there alongside that bigger H2O building. That was the bigger place that we were at. And over the past about a year and a half ago, actually a couple years ago, the other building that's right on top there, that smaller building, that was actually given to us free of charge from another church. So we didn't have to keep renting the building. So we were able to have a free building that we're doing things out of now. But it was really neat to see the community come together, recovery groups, and there's a picture of people coming around the table. Food is amazing, just to have a meal together, share a meal together, and having that time together. And it doesn't matter who you are, we all like, well, I like food, Cole. I don't know about you.
Yeah, I love food.
And so, and we love to have each other. And then in the middle of that picture, there's something, that's one of the recovery groups doing the serenity prayer and holding hands. And that's from I think one of our Celebrate Recovery groups that meets in Scott County. But again, it's just like having the churches and the communities just put aside their differences and just love people. That's what our slogan is: love God and love others. So what else? Oh yeah, and other things I'm doing. It's your turn now.
It is my turn. Sorry, I try to organize. But yeah, so now we used to have no recovery community, none, even though we tried to kind of have one, but it just didn't go over well, even though we needed it. And now we really have a thriving recovery community, more thriving than even a lot of bigger cities that I've seen. My dad is an alcoholic, and I grew up going to AA meetings in Louisville, and they have a wonderful community there. But I mean, I think ours rivals even theirs because they're so close and there's so many opportunities. So we continue to help with our community mental health in different ways now. A lot of the recovery programs have now moved to these other churches that have more space because we have our smaller church that we've been given. But that's great because now there's so many more people involved. And so we're really excited about that. So we're able to focus more on our children and teens like we have done in the past, and mental health. So we teach coping skills to people that come to our church just to try to help them. There's so many things to cope with. Even younger people are going to school. There's so many things, they're just trying to help them with breathing and just a lot of different things like that. And we provide families with food and just a sense of community where you belong and there's no judgment there, just love. That's why we try to provide. And I think a lot of churches in our community are trying to provide that as well. And then Billy also helps with things.
Yeah, and since then also, I used to work for the Department of Child Services for about 15 years, and then this past year, I changed occupations, and for a couple of years, I work with Dr. Cooke's office with Foundations Medicine, providing mental health therapy for people, for patients, and I'm working on my LCSW, getting my clinical hours as an LSW. So there's quite a bit of hours to do around that. And I'm also a school social worker at Scottsburg High School. And then we pastor the church. And then is there anything else that we do? You homeschool the girls. And
yeah, but pastoring the church is just for fun. That's what we do for fun. It's volunteer work, so we're strange.
Hey, thank you so much, Dana and Billy. So now we're going to move to our final panelist here, Cole Boyt.
Hi, my name is Cole Boyt. I had a simple upbringing, grew up in the country, good family, but just kind of, we did our own thing, stayed to ourselves. The community, I had my grandma, she lived in Austin. And coming into Austin, that was going to the big city for me, even though did we have a stoplight back then? It was a blink. Yeah, we had one, I think. So, but that's big city to me. And just the way the social side or the economic side, it wasn't very, it wasn't a lot of money. So there was a lot of poverty. And that was it was normal for us. Several generations of people, it wasn't really the hard drugs so much, but it was just socially acceptable. And I dabbled around, but didn't really go too deep into it. But all my friends did, and I didn't really get it until later. After high school, I had a accident on a job, which later on I ended up having an amputation below my knee. So I have a prosthetic, and that was the right time for whenever they were giving out a whole lot of pain medicine. And I turned it down before, it wasn't a thing, whatever, but after I started having the surgeries and all that, they were overprescribing me pain medicine. And of course I wasn't complaining after I found out how the pain medicine affected me. And so I became addicted to the opiates, and that was the right time for when all this happened. And but really, I see it as a blessing. This has brought a lot of awareness, and I'm hats off to Dr. Cooke for what he's doing around there. Just seeing the change over my lifetime of getting people healthy and getting resources available, and people like this in our community that has a passion and an empathy for other people, and we can relate to the situations. We all come together, and so it's really great, to be a part of it, actually. It's got me healthy, and I wouldn't have been going to the doctor. I'm a stubborn old guy. I wouldn't have went to the doctor unless I just absolutely had to. And this keeps me connected to the doctor, and it keeps me healthy. And seeing the change in our community is just a beautiful thing. That's about all I have.
So I just want to thank you all really for sharing. I just find all of you just so inspirational for everything that you've done in your community, that you've done for yourselves. Just, thank you. You basically give us hope, in the face of really what's, most people would see as immense suffering, daunting obstacles. Like, how can you overcome this poverty, kind of chaotic substance use and all these challenges, all these social disparities that Dr. Cooke talked about in the community, and how do you overcome that? And each one of you have found a way to do that and to give us hope for others who are similarly struggling. So thank you for being vulnerable, for your courage, for sharing today, and for everything that you're doing to help others. So with that, we've got some time here. So I'm hoping folks have some questions. I know that we have a couple of students who've been monitoring the chat, and they can ask some questions that folks have put in the chat. We have 2 mics here. So if anyone has questions, we would ask you to just kind of come up and line up on the mic, and we'll just start asking questions. You can ask all the panel. Dr. Cooke, if you want to come back up and join the panel, we might have questions for you. And we'll just kind of ask away. So Michelle.
Thank you, Dr. Carey. Thank you, Dr. Cooke and panel. My question is about the Hep C. Usually it's very hard for someone to actually get their treatment for Hep C, even after any other extenuating illnesses. Have you all had the opportunity to have your treatment for the Hep C, and how is that coming?
I can talk about how. I can talk about kind of the situation with that, but I'll let you want to answer that first.
Sure. Yes, I have been treated for hepatitis C. I was diagnosed with hepatitis C before I was diagnosed with HIV in 2013. And I have been treated for that. I took Epclusa, which is a 9 weeks, right? I think so. I think it's a 9-week treatment. And today I cannot, it's gone. Whenever you do a lab test, it shows up and I have 0 numbers. Even though, like, if someone does an Insta test, like it'll still always show up that I do have hepatitis C, but I don't, right? Like, I cannot pass it or none of that anymore. So yes, I have been treated.
So when this outbreak occurred, the only people who could treat hepatitis C were infectious disease doctors and gastroenterologists. Not every community has one of those specialists. And again, transportation, access to care is a significant issue when we're looking at keeping people alive and providing them the health that they need. And so we knew we had a large number of people living with hepatitis C in the community, and we're continuing to transmit that to other people too. So there were more and more people. As one of the slides that I showed, every county where there's not a syringe service program in Indiana, the cases are still continuing to climb. And so one of the things that we did was figure out a way to allow me as a primary care provider to treat hepatitis C. And so we did that through something called Project ECHO. And Project ECHO allows a primary care provider to connect with specialists through telehealth. And so it's a spoke and hub model. So the hub has specialists, and then the spokes are a bunch of different primary care providers out in the community trying to provide care, but they need that specialty knowledge in order to provide the care. And so instead of moving the patients to the specialists, we move information from the specialists to the providers so that the providers can treat their own patients in their own communities and not require these long distance commutes. And that's allowed us to be so successful in decreasing the number of people living with hepatitis C in our community.
Okay, a question over here.
Thank you all so much for sharing your stories. I'm sitting there and I feel the spirit and the energy and the hope. And just wanted to thank you all so much. So I'm a lecturer in the IU School of Social Work. And right now my students are tired of me talking about the power of community and the power of group work. And so the last couple of weeks as we kind of head into the semester, I think a couple of them might be listening. But I just want to hear from all of you, like the power of that community, the power of the group work. And you had mentioned how like you didn't have much of a recovery community before the epidemic hit. And so what did you see as like the biggest difference in the community and in the peer recovery support in your experience and the benefit of that?
It seemed like going from we're trying to get people to come to these meetings, they weren't ready. And after we had, like Dr. Cooke had mentioned before, that collaboration piece and everybody coming together, part of that spoke in that wheel was recovery and recovery groups. And there were some people that were identified and new to recovery that were there. There were some people that came up from Jeffersonville, Indiana, from the AA group that started meeting every week. One sole person brought a couple guys. Next thing you know, they made coffee, and there we go. We have an AA group, and then going from that and spinning off into NA groups and Celebrate Recovery. A group of churches came together and said, we don't want to be Celebrate Recovery one church. Is kind of how that model was set up. But we made it Celebrate Recovery Scott County with over 8 to 10 churches that are involved in the leadership. And so it's the churches that came together, the group, and it became, after that first year, you were cool if you went to the recovery group, right? And then the Hope Over Dope came with the peer recovery support. And that was probably one of the biggest hit because they had food. They met in our fellowship area.
Yes.
And they had the good hot food stuff going on.
Yeah.
They had someone watching the kids so they wouldn't killing each other in the gym. They had it going on. And Tony and Samantha, and a lot of people from that original group, Cole, and there were even spinoffs from that with other evenings. So it was really neat because they needed to have something for each other in that sense. And so it seems like it kind of grew into what it was. The NA group grew into some more meetings too. We used to only have a limited amount of just AA groups in Scott County, and now we have a sheet of everything that's going on that's always updated. It seems like they're changing the time sometimes. We have a full sheet of somewhere between Crothersville and Scottsburg and Henryville. There's something going on every day of the week.
Yeah, it's absolutely amazing to see that small community grow so much. And what I think is the most powerful part about all of it is people just like me and Cole with lived experience in substance abuse, and having someone believe in us, which is also probably someone that's also been through the same thing that we went through. But then this is also the community actually listening to us. It was sad that like in 2015 that had to happen, right? Like it was horrible. But because of that, and certain things that's happened now, it's so strong and so powerful, and people are becoming more open and more honest and wanting to be a part of that community because we have the courage to speak up. And because we have that courage, we give other people that courage to do the same thing. And that's what's very powerful.
I think that's probably the biggest difference is those early support groups that were starting up. There really wasn't that anchor of somebody with matured lived experiences who really was confident and maybe had some training to go along with it on how to conduct a meeting and those sorts of things. And I remember, Billy, you and I put out that challenge, come help us. If you're in recovery, come help us. And I remember we had a meeting at Hope to Others, and I remember seeing the sheriff sitting at this table with a couple people in recovery and maybe even somebody who was actively, still using, working on this as a group. And it tickled me to see the sheriff being at the table with people with lived experiences and even people that were still using to try to come up with solutions. And we challenged them, don't go away, don't leave us here, come back, help us. And they did. We've got some really amazing people that came back to Scott County and invested in Scott County with their recovery to give that hope. And now we're doing that, even more. And I can't thank Cole and Jerrica enough for the work that they're doing now with our people living with HIV to show them that there is hope. Jerrica was just working with a young mom, I think it was last week, who was really, just terrified that she had just found out her diagnosis, and she was pregnant, and she was afraid she was going to, pass HIV onto her unborn baby. And so we were able to connect Jerrica, who had, lived through that. She carried a baby, as she mentioned, and the baby doesn't have HIV. And so that real world, this is a real person that I'm able to talk to and learn from and gain hope from. It matters so much more than anything a doctor could say, anything that a counselor could say. Somebody that's been there, walked that same path, knows what I'm going through, and I can see I can do that too. I mean, it's a real person. They did it. I can do it.
I was just sitting there thinking, life happens fast, and there wasn't a whole lot of resources back then, and this has actually been a blessing to our community, because some of the programs that have came in that we participate in has given us a chance to stop and kind of look at ourselves, and that has helped us develop ourselves to be better people, and we can help our community be better people. So that's been a really great thing. So, and the empathy side of it, I know I could talk to Jerrica about things because I know she's been through the same things. She can relate and give good advice also. And so the programs, the everybody coming together has really made a great change in our community.
So I'm told we have a lot of questions in the chat. So if our chat monitors, make sure you guys come up and get a few of those in. But we're going to go over here, and then we'll just kind of go back and forth like ping pong balls.
So my question is, how did the pandemic affect the overall recovery community in Scott County, or your church in particular? And then kind of what has been some of the ways that you have navigated, either with technology access or just kind of being in community with one another? I was just interested in kind of like the last 1.5 to 2 years.
Obviously, everything kind of went virtual. We were told to socially distance. I don't like that term. I would love to change that to physically distance and stay socially connected. And we were able to do some of that through technology. Obviously, people that are kind of living off the grid, they don't know where they're staying the next night. They may or may not have minutes on their phone. They don't have broadband. They don't have data plans. So we were able to get tablets through a grant that we really appreciate, that gets people, the Health Foundation, I want to acknowledge them, that gets people tablets that already have a data plan on them, and they're managed, they have insurance. If they lose them, it gets broken, it gets replaced. We're able to get those into the hands of people who may not have a landline or a data plan, so that they can stay connected to their church, to their peer recovery support, to their doctor, to their counselor, to their support groups, their case managers. And that's really allowed us to stay better connected to people than we would have been able to before.
We also utilize the technology through, we did Zoom meetings with our church people. The recovery groups, I think that they, for a while, they were, they had to stop, and it was pretty tough, and they found other ways around it. They used the Facebook Live thing and some various things, some Zooms that were, because of Facebook Live, well, you get the anonymity, I can't even say it right.
Anonymity.
Thank you. Yeah. Gotta say that real quick. So, you had some of those issues you got to watch out for. Even with our kids, a lot of times, just the messages, we would do food drop-offs and porch services. And so we do like kids songs and stuff. So we would pull up in a bus, and Dana and I and a couple of adults would come out and have a speaker and just do one song, and then give them a bag of groceries, and the family all gets involved. And so it was like that type of thing. So we had to really think outside the box to try to stay connected. And then that messenger, Facebook Messenger, back and forth in groups, everybody's chiming in on things.
Yeah, I just want to say that the tablets that we have received and that they're so helpful because for what me and Cole are doing right now, currently working with people that are HIV positive, they can connect to us right away. So it's absolutely amazing.
So a question over here.
So I'm a high schooler and I have opportunities to educate myself about the risks of sharing needles and all sorts of medical issues, and I can educate myself about that. But how are communities like Austin able to get that education for their high schoolers, especially because, you know, we have COVID, we're doing virtual education. As far as the church goes with CO2, it's not CO2, H2O. But like specifically targeting high schoolers, because it seems like as far as, you know, the experiences have gone, a lot of this stuff starts in high school, and with education these days, are you guys working with high schoolers, or do you have any words you could say for parents who have high schoolers looking to educate their children?
It's actually brought a lot of awareness to that and a lot of resources in, and there are a lot of people. I just wanted to speak before I knew they was going to chime in here, because they are doing a lot of helping the youth, and absolutely that is the key, you know, trying to educate before they go down that road. But sorry, go ahead.
Yeah, and I believe when this first came 6 years ago, whenever, as news came, schools found out pretty quickly there was stigma. For example, the track team was shunned by, you know, they didn't, other teams didn't want to run track with them or cross country, whatever it was. So there were some things in the news where Austin, especially Austin, was not seen very highly when they went into sporting events and stuff.
But now they have various programs
Yes.
within the schools that are actually teaching students. And then even I know with Billy with his social work at Scottsburg, which is also a part of Scott County, there, and I think this happens in Austin too, there's just a lot more attention to let's help these kids make good decisions. Because it's not all about don't do drugs. I mean, it's all, you know, it's all connected, and just helping them to make good choices and have coping skills and things like that so that they won't have to go down that path. Yeah.
There's programs in the schools now that are evidence-based, based on, it's called dialectical behavior therapy. You can look it up later, but it's evidence-based. It's being put into schools. It's basically life skills, how to deal with overwhelming emotion. And that can help people deal with, you know, the trauma that they're growing up with. And then just good health education that we shouldn't, you know, fall into the idea that it's only about personal responsibility, but we also have a social responsibility to educate each other, to protect each other, to wear masks, for example, to physically distance. As far as, you know, sex education, you know, teaching, you know, kids that, you know, condoms will decrease the risk of contracting a sexually transmitted infection, that in injection drug use, if you're sharing syringes, it's okay to teach high schoolers at that age that if you share a syringe with somebody, a needle with somebody, you may contract an infectious disease. Don't do that. So teaching, you know, having those conversations, they're difficult, but they're necessary if we really want to protect our children, because we can't be with them all the time. We can control them when they're within our house only part of the time, right? Daughter. Even inside of our house, we can only control them part of the time. So what's going on outside of our home? We can't be there to protect them. So teaching them the tools that they need to protect themselves is actually caring for them. It's not enabling them, it's caring for them, because we don't want them to contract a disease that's preventable, frankly.
Yeah. All right, so question over here.
Thank you. I heard the town of Henryville mentioned. Is that Scott County?
No, it's directly south of Scott County. It's right in the next county.
Which is what county?
Clark County.
Clark County. Well, maybe this pertains, but what famous person was born in Henryville? Does anybody know? Colonel Sanders.
That's right.
Really?
And he, now it's close enough to Scott County to make my point. that his face now is all over the world. People see his face, this Henryville born Clark County Hoosier, all over the world, including in the communist Chinese. 1.5 billion of them are looking at his face. So there is hope for Clark County and for Scott County. My question is, there's another book written on this general topic and other books as well, I think. But the book I'm thinking of is Hillbilly Elegy. And the author now is running for the United States Senate seat in that state, which is just to the east of Indiana, which is hated and feared by every Hoosier. So anyway, Hillbilly Elegy, speak out, please.
It wrestles with that contrast between personal responsibility and social responsibility. And I think one of the things that I got out of it, reading it, was that he had that one person growing up in poverty that had his back, that he could always turn to, that was going to defend him no matter what. His grandma defended him tooth and nail and held him accountable when he didn't study and those sorts of things, and loved him and cared for him. And he knew no matter what, at the end of the day, his grandma was there for him. And he grew up with that, and he was able to achieve a lot more in his life. He went on to Yale Law School and became an attorney. Not every kid grows up with that. And if you're growing up under poverty and toxic stress and you don't have that one person that you know has your back at all times, you know, the world looks a lot different. And that's what I got out of the book personally.
So Caroline, I think you have a question from the chat or two.
Yes, this is directed towards Jerrica and Cole. Morgan, who is a community health worker, asks, can you offer any insights or wisdom regarding your earliest days of diagnosis? What did you wish your experience with first hearing your diagnosis would have been?
Yeah. So when I first heard my diagnosis, it was June 6, 2015. And when I got that diagnosis, I thought that it was the end of the world, right? I actually tried 2 days after that to commit suicide because there was no programs and there was no one there to help me during that time. Almost everyone that I knew around me, every person that I was using with had contracted this virus. And it wasn't, that it was just very, very scary. And my drug use plummeted. I just became even more worse. I distanced myself from family. I didn't want to communicate with anybody. It was all downhill from there. And that's what I thought. But as of today, and if there was programs in place, and such as, I'm going to speak on this, in 2015, because of the epidemic, they brought SSP, which is the Syringe Service Program, into Austin, Indiana. And if it wasn't for the SSP program, I don't know where I would be today. The main reason for that program is because they got me the insurance that I still have today. Of course, I renew it every year, but it is the insurance that started me out on the medication that I needed to take to stay alive. When I was diagnosed, my numbers were not high. My CD4 count, it was not out of control, but of course I needed to take this medicine. And because the SSP was there and I was able to walk into that program and know that there was people in there that, one, I either used to use with that was now in recovery, or was actually someone that just cared about me, just genuinely cared. Because of them, other programs came in the community. And then, Dr. Cooke's Foundation's Family Medicine just became a great resource in that community. But yeah, so back then it was very, very, very scary. And I thought that I would never find a man who loved me. I would never get married to anyone. I thought that my family would hate me forever. And the stigma was huge. And stigma still exists today, but because of the peer support that we have today, and because of other people just like me having courage, one, and just wanting to show people that we're human. Just because we have this doesn't mean that we're not a human. We're not somebody's daughter. We're not, or we are somebody's daughter. We are somebody's granddaughter. We're not just these horrible people. I had an issue, I had a problem, and I suffer from the disease of addiction. But because of that support that we have today that was brought into that community, I'm sober now. And I have people that I know that I can genuinely call that are going to help me. So yeah, thanks for letting me share that.
I was diagnosed in 2016. Mine's a little different. I kind of look at mine as a blessing because Dr. Cooke had a mobile unit that was going around. I was in active addiction at the time. And so I was testing, I think about every month then. They would I think it's every 3 months or something like that. But I think, it was just a good conversation to have with us, I think. And it was a good opportunity to reach people like me still in active addiction at a high risk of contracting HIV at the time. And so whenever I did find out, same thing, it was bad. We didn't have any education on any, what the future would look like for that, so yeah, it was bad just for like a month or so, but I got a hope shot. I had somebody that I was friends with who had went through the same thing and was thriving, doing good, gave me some good advice. I followed up on it, started taking my medicine, became undetectable really quick. And I think my main point is just that hope shot of seeing someone. And I think that's why Jerrica and I are so passionate about this, to try to be that for someone else. And it's, it was a blessing.
Okay, a question over here.
Evening. My name is David Wild. I'm an undergraduate here looking to get into medicine. So you talked a bit about how we're better at keeping sick people alive than we are preventing disease, and how this has plateaued life expectancy in this country. So how do you think that we can promote a culture of health and getting people to seek help and just overcome the aversion to taking that personal responsibility for your health so that they can prevent disease?
Yeah,
especially in rural communities where we have this culture of not seeking help, to suffering in silence.
Yeah, thank you for that question. I would say that right now we have a definition of healthcare that looks an awful lot like a product that we buy, and people who are able to afford that get it, and those that don't. And so I think we need to redefine what healthcare is. And what healthcare is are those 7 vital community conditions. It's a thriving natural space for people to get outside and exercise and meet one another and have safety as they walk to grocery stores and schools, reliable transportation, humane housing, livable wage, lifelong learning, and really just access, that sense of belonging and safety, that it's okay to not be okay sometimes, and to seek that one person that has your back, or that clinic that's not going to stigmatize you. I think that if we can redefine healthcare there and invest in that as a community, we'll get where we need to be, to where people are growing up and not getting sick, instead of just waiting for them to get sick and then treating them with this product that, if you have enough resources to afford. Jerrica mentioned she didn't have insurance until she contracted HIV. We shouldn't wait for that. We should be really connecting with people where they're living and growing up and playing and working, and providing them everything that they need, basic human safety needs, and all those other 7 vital community conditions, and define that as healthcare and invest there instead of investing in diseases.
Okay, so question over here.
So as I understand it, the Scott County Commissioners recently ended the Syringe Service Program. And I'm piecing together too that was an impetus to open doors to create this other wonderful community opportunities. are there concerns now that the SSP that the commissioners ended it in Scott County? And I feel free to be candid, Jerrica, because I love the look. I mean, I really want to know your honest opinions.
We experimented with things before the syringe service program, and we know what happened. So the fear is that that would happen again if we lost the syringe service program. Fortunately, they gave us until January 1st to come up with a new solution, and there is ongoing work, and it really looks positive that there really should be an alternative in place that's legitimate, that can stay connected with all the resources. The greatest fear would be that it would be underground, and that it would be hard to connect because our viral suppression rate, our recovery support system, all of those depend on us being able to gain access to people that we don't have access to right now, and allowing people to make healthy choices by giving them that option. So it looks like there's going to be something in place. We had a really good meeting this past week with a lot of positive progress.
And Cole and Jerrica, I could see you both just like you wanted to chime in and say something.
Well, honestly, I went to that commissioners meeting and I spoke at that commissioners meeting, and I just want to, say that as of right now, there is something in place, and I don't want the community to be in fear. I don't want people like me and those people that are out there suffering still and using. I don't want them to be in fear, because I know that we have people that are in the community that genuinely care about the suffering addict, or that still genuinely cares about people that are still using drugs, right? They believe that we are just people that either have mental health issues or several other reasons for why these people are using. And we do have something in place for that. And I look to a bright future. And hopefully, as we go forward with this and, move forward with this and maybe into next year, more people realize that this just isn't some place where you go get a needle, right? Like, and that's what they look at it as. And that word needle, syringe, like that's not some place that you just go do that at. Hopefully people understand that this is for education. This is to help them be stable, to help them be healthy, to, just in general, help them get treatment. All these other things that roll into that program is just amazing. It's not just about that. So hopefully we can continue and make progress. And, I wish that people can be, or hopefully can become more open-minded. And I'm starting to see that more and more. Like this week, we had a great thing that happened. So hopefully, the community is just coming together. So thank goodness for that.
Yeah, I think it was just the stigma behind this syringe exchange program in our small community. That's kind of threw some stumbling blocks out there, but it's undeniable that there are a lot of resources that have come along with it. And I think we're just trying to find the right path to, there are a lot of people coming together that want all that, and we're just trying to figure out the right direction to go with it.
Thank you for that. That was super helpful. I appreciate everybody's feedback.
Thank you. I'm Paul Halverson. I'm the founding dean at the School of Public Health here at IUPUI. And I just wanted to say thank you, because you've shown a really bright light on a really important issue for our state. And I think what I was so heartened to hear is you described that out of dismay came strength, and the strength of your community and people coming together to help support each other. I'm sorry to say that that's not true throughout the rest of the state, that there are communities where that doesn't happen. But I'm also perhaps most troubled by the fact that I think your public health system really failed you. And here we are in Indiana. Frankly, our overall health status, we're 41st out of 50 states in this country. And our per capita spending on public health is 48th. We're at the very bottom of the barrel. And what happened in your community wouldn't have happened with an effective public health system, both at your local level and at the state level. And I can't help but wonder what this picture would look like. And Dr. Cooke, I'm so appreciative of your leadership and your compassion and your values, because at the end of the day, that made a huge difference for your community. But I just wonder about whether or not, if we had an effective public health system, what this picture would look like, and your thoughts about how you might be able to be even more effective. If you know, the whole idea around syringe exchange, it's not a scientific question. That issue has been adjudicated, right? It's not about personal responsibility, it's about community responsibility. And I'm so thankful for your book and for your presentation, for your willingness to share tonight, because I think this really is a picture of what the public health system should be. But it would be lovely if we had the public health system actually engaged and involved in helping. So your thoughts about that would be appreciated. But again, thank you so much for being here tonight.
I think it would be a more diverse Mayberry, possibly. So let's bring some diversity to Scott County on top of everything else. And when I say Mayberry, there's a few of us get what that means, right? There's a few of us.
You know, the difference between public and private health kind of gets at that product versus just social responsibility idea. You know, private healthcare is something that people can afford. They'll go get. Public healthcare is for everybody else. And as COVID-19 has really, I think, demonstrated that our public health system across America, not just in Indiana, is in shambles. And in places like Indiana, it's even worse. So investing in that public health system to allow there to be that infrastructure in place for when these crisis moments happen, screening and being able to rapidly respond to crises when they occur, and to be able to roll out good public health policy quickly when it changes, to be able to vaccinate people quickly when we need to be able to do that, for example. And that investment is really going to take, you know, looking at long-term investments versus like 6 months, 1 year grants. They're appreciated. Those are great. But how do you invest in your workforce to develop the skill, the expertise, the training needed to be able to take care of certain things within the community if you only have a year? You know, if it's a 6-year grant, you can spend that first year to developing the workforce that then has the expertise and the training and the know-how and the skill to be able to go out and enact that grant, whatever it might be. And I think making those grants cross sector, so that sectors are working together, you know, public health working with education, and we leave out industry a lot of the time, you know, bringing them into the solution as well.
Phoenix?
I have a question from the Zoom chat from Armand, and he asks, how can we engage in the political process to compel elected officials to improve policies related to public education, healthcare in rural areas, and preventing the slide into homelessness that comes with the conditions of poverty?
So, you know, politicians, they listen to things that help them get influence, power, and money, funding. So people that have funding, they can use that. People that have influence can use that. People can pull together to show politicians that there's power behind the number of people coming to them. As far as the political debate about different things, I don't think public debates really move the needle at all. I've seen that very clearly in the commissioner meetings. It gets heated and people just bunker down into their preconceived ideas about things, and they defend it tooth and nail, and you never get past that. So I think it's quiet conversations outside of the heat, outside of the lights and camera, developing relationships and let people know that you're a real person that has concerns. And through that relationship, sometimes they do start to listen and hear you. And then learning or meeting and interacting with people with lived experiences. It's hard to stigmatize somebody that you respect. And I respect Cole, respect Jerrica. They're my friends. They're my role models. I look to them and I think, you know, I can do this work because, you know, it matters. It matters so deeply for real people. And when politicians meet real people, it's harder to, you know, dismiss them than it is if it's in a public, you know, heated debate setting.
I had another question for Jerrica and Cole. Would either of you be comfortable talking about how your journey with addiction and recovery impacted your role as a parent?
Yeah, absolutely. So for me, how it impacted my role. So I'll go ahead and I was pregnant in 2014 and I was using drugs. I was pregnant with a little boy, and 7 months into that, I had not gone to the doctor until I stepped foot into Dr. Cooke's office. And my son was, I didn't know what was going on. I was using drugs. I honestly, the drugs had that much control over me that I was honestly fearful for what was going to come next. When I realized that it was time for me to go to the doctor, and I was showing and all these signs started happening, and I said, okay, I have to do something. And I went and I showed up at Dr. Cooke's office, and they treated me like a human being. And the first thing they did was get me help. And they directed me to a medical assisted treatment, which they are now calling MAR, medical assisted recovery. But they directed me towards medical assisted treatment, and once I began that and I started taking that, I started going to the doctor, and then my son was born April 4th, 2015. And when he was born, he did have withdrawal symptoms. He was in the NICU unit, and he went through severe withdrawals. He was there for 28 days, sorry. He was there, and then I brought him home. And I feel like a lot of that shame, that guilt, that remorse, because when we brought him home, obviously he was healthy, but all that shame, that guilt, that remorse, and everything that I was dealing with at one time, I didn't think that I could be a good mother. I felt like there was no hope. And the only hope for me was either I was going to die. And then if you didn't notice, I was diagnosed June 6, 2015 with HIV. I didn't have it when he was in my womb, thank goodness. But the very first time that I got tested for HIV, he was in my womb. But today, and as me being a mother today, I have a little girl that turns 2 on December 7th. And she is a blessing. And that little boy that I talk about is extremely smart. He's probably one of the smartest kids in his class. He enjoys spending time with his little sister today. I have a great relationship with him and my daughter. Our time's tough, absolutely. But because of the support system that I have behind me today that I didn't have back then, I didn't have that support system. And also, I was very selfish. I have no one else to blame but myself for my drug use, right? I was a very selfish human being. And I had to understand that I had to take full responsibility for my actions. And that started off, it was no one else's fault but mine for these horrible things that I had done, especially to that little boy. And I had to have time to heal. So in order for me to heal, I had to join a 12-step program. And this 12-step program introduced me to a higher power. And that higher power has taken me places that I never thought that I would be at today. But I know that dealing with all of that, and I know for the people that are out there today that are suffering and doing the same things, I found it in my heart to forgive myself. And I know that if I can forgive myself for all the horrible things that I've done, including using while pregnant, having all these other horrible things that I've done in my life, if I can forgive myself and come up out of that darkness, that anyone can. But it starts off with, it all starts with you and you having the willingness to make a decision. And I feel like because of the recovery and because of the recovery community and because of the people and the peers that I have in my life today, there's no doubt that I want to use. I don't want to use. I don't want to lean to drugs. Drugs isn't even something that pops into my head, which is a blessing, but it has taken a lot of work. And it's, like I said, it's not easy, but I enjoy life today. I don't just, I know a lot of people say this, but I let that disease of addiction and the disease of HIV define who I was for a really long time. The addiction before it was the HIV, but I no longer let that define me as a person. I let it, embrace me and make me, I use that as a blessing and to help others, and including parents that are struggling, that have children either in the womb or children that they have at home and they're having problems with. I give them encouragement because it's not the end of the world, and things can, you can, just as long as you have that willingness to change, you can do that.
Yeah, that's that hope shot that pulled me out too. Yeah. Yeah, the peak of my addiction was probably a year or two after my daughter was born. And just the addiction, it's not just parenting, it's everything. You can't have anything. And just getting into recovery, learning coping skills just for life. Take the drugs out. I still was a whole mess for a long time. I had to figure out a lot I had to learn how to live correctly, which I wasn't trained before. Mm-hmm. So, yeah, parenting these days, it's still stressful sometimes. I was going to say it's all roses and everything, but actually, it is nice, but yeah, you just, through the addiction, I couldn't do anything. It wasn't just the parenting.
Yeah.
So we're almost out of time. So I'm just going to ask one question of all of you, and then most of the panelists I think are sticking around. So if anyone wants to have conversations after, they'll be here to talk, one-on-one. But my question is for the individual who's currently in active addiction, struggling, like there's no hope, there's no way I'm going to get out of this. In just like one sentence or less, what would each of you tell that individual? What kind of advice, a tip that you could just give them? We'll just start with Cooke, Dr. Cooke, and go all the way down.
I'd start with that people can only make choices from options available to them. So we have to make that option to get help available to people. But I would say it's okay to not be okay. Reach out for help if you need help.
It's totally possible. I remember that feeling of there's no way out of this. So yeah, having options available, having people that I seen been through the same thing, having compassionate people around, trying to give myself options. It's doable. You just got to find something to inspire you to take that next step and just not use. It's doable. Reach out. Don't isolate. I isolated, so that's a bad thing. Don't isolate. Reach out to someone. No one knows what's going on in your mind until you speak on it. So speak on it.
You are valued. You were born for a reason, and no matter what you're going through right now, we're here for you. Look around you. There's other people that'll be here for you. Find help. It's out there.
And maybe just to let people know who are going through that, that the recovery community, it can seem scary to go to that first meeting, but the recovery community are the most supportive people I've ever seen. Like if you go to a church, sometimes you're like, do they want me here? Am I dressed right? But oh my goodness, you go into a recovery community and they're just like, come here. And they are awesome. Like I like to go to the recovery meetings because they are just so wonderful. So just realize that you're going to be accepted there.
So one of the things that I like to say, hope, what hope stands for, right? Hold on, pain ends. Because a lot of people like me didn't believe that there was hope, didn't believe that there were second chances, didn't believe that I could be that mother, didn't believe that I could be a good daughter again, or for my family to be proud of me. But that pain that you're dealing with, it can end. And that's what I would say. Hold on, paint ends.
Okay. So here's a whole bunch of resources, because a lot of you might be wondering where can we learn more about a lot of the different things that were shared this evening. So this is on the slide and it'll be there if you need those. And I just want to say that, this has really been amazing. The brilliant work being done by our speakers, others in the community across the state are really moving us forward to dismantling stigma related to HIV and injection drug use and ending the HIV, hepatitis C, and opioid epidemics in Indiana. Please, if you'll all join me in giving our amazing speakers a round of applause and thanking tonight's panelists, Dr. William Cooke, Jerrica Hall, Billy and Dana Snowden, and Boyt. It has been an absolute pleasure holding this event and just honored to be here with you tonight.